Welcome to your Excellent Health Service TV with Dr. Charlie from Harley. We're here talking to Dr. Charlie about Pete Burns, the former, I can't actually remember the name of the group now.
Yeah,
but
it was Dead or Alive.
Dead or Alive, well,
Dead or
they're
Alive.
quite appropriate really, so now we know.
Absolutely.
But I mean, he was 57, lots of operations and
Plastic surgery,
I mean, clearly he had some issues with the way he looked.
Yeah, and Pete Burns, I suppose, had a lot of image issues and self-confidence issues, but the other side of having a heart attack at such a young age is that it may be that it was a genetic factor, so he may have had a tendency towards that. It may have been high cholesterol, or it may have been lifestyle. I don't know Pete Burns' exact history, but I would be reasonably confident that in his younger days he probably did a fair amount of drugs. And one of the things a lot of people don't realise is cocaine can lead to early heart disease because it causes vasospasm in the coronary arteries. So there are a lot of actually quite healthy 30 to 40-year-olds who will have a heart attack from cocaine, even though they don't have any other pre-existing conditions. People like Pete, I think, probably smoked a lot as well, which would have been another factor contributing to that early heart disease. So what I suggest to men, certainly, well, all adults really, over 50, again, back to the numbers, know your blood pressure number, ideally know your cholesterol number, cut down on your salt intake, and there are websites like just Action on Salt which tell you where the salt is in your food, cut down on your sugar intake, exercise regularly, and if you can, get a proper heart scan done, because the thing about an ECG, we talked about these earlier, they're just a rhythm strip. So they won't necessarily tell you about the patency of the heart vessels, and they have to be open and not blocked so you don't have a heart attack. But there are ways you can have a sort of CT scan. It's not cheap, but that will tell you whether the arteries are patent or not.
Right, well, I'm a middle-aged man, and I know what they're like. You give me a list of things which I've got to be very diligent to do them. What's the one thing that you should do, if there's anything? If you're,
Yeah, I think regular exercise. At least 2 to 3 hours a week of exercise that makes you feel breathless and sweaty.
I'm going to live. That's what I do. That's all I do, unfortunately. Dr. Charlie from Harley. Thank you very much.
Thanks, Zach. Thank you very much.